Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, we're talking about the role of a chaplain. When a chaplain shows up in the hospital, people assume someone is dying or the chaplain is there to deliver bad news. Yes, those are some of the responsibilities of a chaplain, but they do so much more, including providing spiritual support as families are faced with tough decisions. They can also be supportive, a supportive resource when a person's hospital stay is ended. Reverend Jennifer Collins, Director of Pastoral Care with Chippenham and Johnston-Willis Hospital, is here to talk more about it. Now, yours is really a tough job. People either want to see you or they dread seeing you, but so much more is involved. What are some of the other responsibilities people typically don't think you are responsible for?
Well, I am a facilitator on the ethics committee at the hospital. I am part of the palliative care team as well. I am also a advanced care planner, which is a facilitator through the Richmond Academy of Medicine, which means we do medical directives for patients and families as well as staff. We do memorial services at the hospital. I often do funeral services. I do weddings. So there are a lot of other things that we do other than show up when people die or are at end of life.
Talk some about your role with the patient and family care.
Patient and family care, we provide, yes, the emotional and the spiritual support, but we like to call it companioning with the patient and the family through the crisis. Anytime someone shows up in the hospital, they are in crisis, and there are these subconscious questions that they're asking themselves that we call existential questions. Am I safe? Am I valued? Am I worthy? Am I going to be cared for? So we're part of the team that helps them to navigate those questions.
And what should a patient and their family expect from a chaplain? I know there are probably instances where they might say, we're not interested in having a chaplain.
Right.
And others, they really want someone there. What are the expectations?
The expectations of a chaplain is that we're going to be calm, that we are going to bring peace into an otherwise chaotic situation. We help the families to navigate the healthcare system from our perspective, from the emotional and the spiritual perspective. We are there because it is emotional as well as spiritual. We will pray with the patient if they would like, but if not, then we're okay with that as well. So we meet the patient and the family where they are, but the staff as well.
Awesome.
We're there for them.
Reverend Collins, thank you so very much.